Right, everyone, welcome back to another episode of Recharging the Human Battery. I'm your host, Dr. Stefano Sinicropi. I'm back today for a really important episode. You're definitely going to want to tune into this one because a lot of you or your families are really struggling with these problems we're going to talk about. We're on AM 950 radio, and we've been doing this for a while, and I think it's really we've gotten some great feedback. It's really important for me to share some of the things that we are seeing just in the medical community. So, we always talk about things like biohacking, how to become the CEO of your health, all these different issues. We've talked about concussion, we've talked about diets, we've talked about influencers. We've really covered a lot of things. But you guys know that my personal passion for 20 years as a spine surgeon has really been to take care of people that are stuck in these doom loops. And listen, when it comes to back pain and neck pain and things like that, obviously those are huge problems. There's millions of people suffering from that stuff. We don't have to talk about it much today. We've talked about it so much on the show today, but that definitely translates into things that I am now taking care of on a daily basis in our integrative health clinics. There are so many people that are stuck in these crazy doom loops. I mean, they're traveling all over the country. They're spending so much of their money just trying to get their lives back. And then there's a whole other segment of people that are just not even diagnosed with some of the conditions we're going to talk about today. And honestly, this isn't like, hey, you get these conditions and you just feel a little fatigue. You're just not normal. You're just not yourself. I mean, some of these, the two things that we're really going to dive into today, these can be devastating. They ruin lives. They take people that were once thriving, having great lives, doing whatever, and then completely change the trajectory of their entire life, where their entire focus of their being is how they feel. They feel awful. They're sick. They go from doctor to doctor. It's a mess. And so these two conditions I'm going to focus on today are the following. Lyme disease, okay? Lyme disease is something that affects millions of people in this country. People often think, oh, Lyme, it's a tick bite, and it happens in the Northeast, and other people aren't affected. Well, Lyme is pretty common here in our state of Minnesota, but nationally it's very common. In fact, the CDC estimates, these are more recent estimates, about 476,000 cases of Lyme occurring yearly based on different data and records that they looked at. It's way more prevalent than that. We see it all the time. When people transition, they're not treated early because a lot of times it's missed. But when they're not treated early, they can turn over to chronic Lyme, and then they have a huge problem because it can manifest in so many different ways and it's often missed. The second one, which is huge, okay, in the integrative health world, in the functional medicine world, that we see all the time, and that is mold toxin illness. There are so many structures, not just in Minnesota, but all over the place, that have a mold toxicity problem. There is estimated to be about 50% of structures by the Environmental Protection Agency that have some type of water damage in them, and that can lead to mold toxicity. So then you get all these toxins that are kind of spiraling around, and people can get really sick, especially if they have these genetic predispositions, which about 25% of the population have. And so a lot of people come in really sick with mold toxin illness. They've been everywhere. Some of them are diagnosed, some of them are not diagnosed, but they're just looking for answers. I'm going to spend the episode today talking about this, and I know those of you that are listening, you might know or people that have these conditions. You might not, but I will tell you, people that have these conditions. It's that prevalent in our society, and it's just not picked up, and the treatments can use a boost, and I think that we can do a lot better, and I want to talk about what our treatment strategies have been at the Integrative Health Clinic and how we work with other providers to really try to get people on the road to recovery. So we're going to pick up this on the other side of the break. This is Recharging the Human Battery Radio. I'm Dr. Stefano Sinicropi, and we are on AM 950 radio. See you in a minute. Human Battery Radio. I'm Dr. Sinicropi. We are on AM 950 radio. And like I said on the intro, this is one of the most important shows I've done. People are asking me now, right? They come in or they call and they're saying, why is Dr. Sinicropi treating these types of patients right now? Well, I'll tell you why. I'm just going to give you the background story, then we're going to get into the diseases because we have a lot to cover. Here's the deal. I've spent, like I said, my career treating people that are in these loops and treating people that have chronic diseases. And a lot of what I've treated over my career is really chronic pain, chronic kind of mental health disorders that go along with having chronic pain on a daily basis. And some of the patients we've treated with operative management, most we've treated with conservative management, trying to get their lives back. Well, here's the situation. There are all these conditions out here. We've talked about concussion quite a bit on this channel. Chronic concussion affects millions of people as well. But there are these conditions where people get stuck in these crazy, doom loops. We just say like, 1 foot, like one foot on a banana peel, 1 foot in the grave. There's all these different sayings that we could say for these people that I would call gap patients. A lot of them don't have specific diagnoses. They doctor shop. They go from place to place. They're on a million supplements or they're on nothing because they've never been diagnosed. It's a huge problem. Bottom line is they're crying out for help. And so what I have been doing here over the last couple of years as really diving into this integrative health space is taking all of my, years of experience treating tens of thousands of people that have chronic conditions and trying to take those principles and those strategies and then translate them over and taking a fresh look at what is available for patients that have conditions like Lyme disease, like mold toxin illness, or CRIRS syndrome. And it is just a different strategy. So I will say this, as we started treating these patients, we certainly have many of them that have gone down a more holistic functional medicine path where they're looking for kind of root cross strategies. Some of the things that we've identified is some of those people are so drained, okay, right? What's the name of this show? Recharging the Human Battery. Their battery is so drained that doing all of these chemical detox interventions or toxin binders or all these other things, those of you that are struggling with these conditions, you know exactly what I'm talking about. And you're on all of these medicines that you've been placed on, or we'll call them supplements. Okay, there are some medicine, but mostly supplements, and you still feel miserable. Okay, because your battery is drained. There's no reserve, and so are there better ways? And so we have come up with all of these different protocols based on physics, which recharge the human battery. Okay, this has been our tagline from day one. And then allow them to try to heal themselves. It's a regenerative medicine concept, but it also allows a lot of these chemically based interventions that functional medicine has developed to work a lot better if your cells are charged, if your mitochondria are working better, if your immune system is more calm, then those things are going to work better. If you're taking patients that have zero reserve and trying to detox them, oftentimes they can be met with a lot of fatigue, over detoxification, they don't feel well, they're in these spirals, some of them even can get worse occasionally, and it's a huge problem. So this is a group of folks, and I wanted to do these two conditions because there's so much overlap in how much things are missed and how often people have seen so many physicians or other types of providers trying to get help, and sometimes they end up just basically banging their head against the wall and just saying, no one's helping me, I don't know what to do. Some people just give up and they just live very sickly lives because they do not know what to do. So that's why I'm telling you, this is one of the most important shows that I have done now treating these patients on a regular basis. So let's talk about the doom loop. What are these patients told? Okay, people come in for both of these conditions. They have severe fatigue. they can have joint pain, they have crazy brain fog. Some have like serious psychiatric disturbances in both conditions. They present differently, but there's anxiety, depression, all kinds of things can happen from these conditions. What happens though? They might go to their primary care provider. Well, your general labs are normal. Your Lyme test didn't come back. Most of them are not getting tested for any of these, like mold toxin. There's a whole battery of testing that you can be sent for that. So they're said, well, you're just a little miserable, you're depressed, take an antidepressant, this and that. Sometimes they're even told by their rheumatologist that things are normal. They can't really find anything. The pathogen's gone. Lyme is no longer there, so they don't have much for them. Infectious disease specialist, same thing. Go to psychiatrists. You are depressed. You have anxiety. Let's put you on some meds. Let's do some counseling, etc. Those things might be helpful, temporarily, but they're not looking at what is actually causing this and trying to reverse that problem. So the reality for these patients is they're miserable. They're losing their careers. Their marriages are going down the tubes. And joy, one of the things I talk about a lot, it's actually in my, like in the there's dictionary that I created called the Hypercharge Codex. It's just sayings that we do. It's something called the joy quotient, right? Like how high is your joy quotient, right? Your JQ. Instead of your IQ, it's your joy quotient. Forget about it. Okay, what joy can you have when you feel like crap? I don't have a better word for it. So because they can't find a billing code for you or a medicine, one size fits all, what do they tell you? It's all in your head. Half of the patients I see with these two conditions have 100% been told it's all in your head. I'm telling you, it is so common. We don't that is not in my dictionary. That's not in the lexicon. It's all in your head. You never say that to people. So if there's providers listening, do not tell people it's in their head. That is a disaster. Let's move on. So these people are vulnerable. That's another aspect to it, okay? And we can talk about that for an entire show. So what do we consider a vulnerable patient? Some patients are so desperate, you could sell them like some juice or some wild supplement or some herb for $1,000 a week, and they'll buy it. Why? Because they do not even know what to do. So people also have to be really careful where they're receiving their care, because otherwise they will be, and they'll end up just being taken advantage of with things that don't have any track record, of working. The vast majority of people treating these conditions are dedicated. They love what they do. They're trying their best, but there's still some dangers out here, and people are selling these what we call vulnerable patients all kinds of hopium, another word in my dictionary, and they end up just getting sicker. They waste their money and they go on for there. So there are more advanced options that we can offer people. So I want to arm you with the physics and the biology to be able to really tackle this. Again, like I said before, chemistry is great, utilizing chemical means to detox and do other things. I think that was a big advance in how we treat these things. And obviously laboratory analysis has gotten better. That's an entire other show. I'm not going to get too deep into that. But the bottom line is utilizing physics principles through biohacking strategies can make a huge difference with the way we treat these people. And they just do a lot better because we're recharging their human battery. I'm going to keep coming back to that theme. It's the perfect theme for a show, name this. So here's the thesis, right? You aren't crazy. You're toxic. Okay, whether you have a Lyme disease that's just hiding in there, or your immune system has gone crazy because you've been exposed to it, even if you're legitimately cleared, you're still fighting a battle. Whether you're, if you've got, these mold toxins in your body, especially if you're having continuous exposure, it can wreak havoc on the body, and it's a huge problem. Standard medicine, a lot of times, is just not equipped to take care of these problems. In fact, standard medicine has had a hard time even categorizing these things and putting them in boxes, which is why people are told it's all in your head, and this puts them worse and worse into these doom loops. So I just want to so how many people get breast cancer a year? 290,000 people get breast cancer a year. You know how many resources we're putting into breast cancer. My mom died from breast cancer. I am Mr. Let's fund breast cancer research. That's great. HIV, 30,000, cases a year. We've done amazing things in HIV, and now it's just a chronic, illness where people used to die before, and that's great. But again, Lyme disease, 476,000 people a year with Lyme's disease. Where is the funding? It gets a fraction of the funding. It's insane. It's almost what I would consider a silent epidemic. But being somebody that sees these people, some of them their lives are completely ruined. I remember we had this 17-year-old kid that we were treating. He had to drop out of college. The guy could hardly think. He could hardly put any food in his mouth. I mean, these people are really, really sick. It is a devastating condition, and you can get all kinds of co-infections with it. So the bug, okay? The name of the bug is called Borrelia burgdorferi. So just put that. We're not going to test you on this, but it's this bug. It's a spirochete. It's like this corkscrew bug, and it's kind of shaped like a drill bit. Okay, and it bores in, it lodges in, and it can cause absolute havoc. Now, when you first get it, you can get like a specific type of rash that, if picked up early by the medical system, the good news is if you get your Lyme picked up early. So if you get a tick bite, first of all, you should get treatment. You should have treatment, period. And if you see that rash and pick it up and live in an area that's densely wooded, you need to go in and get treated, because early antibiotic treatment is really the key to preventing you from getting into a chronic Lyme position. Anyway, we're not going to talk about it. I'm not really here to talk about the acute stuff, because people that are aware, get a lot of tick bites, they do go and get care. Usually it's these people, you don't even know you've been bitten by a tick. You get infected by this thing. You start having all these kind of weird symptoms. You may have a fever. You might feel, but it might not. You might not get sick enough to even know to go in. And next thing you know, you have chronic Lyme, and the world is kind of not the same, anymore. And so when these people are infected with Lyme, this bug is brilliant. Okay. So without getting really, really deeply into it, there are different ways that it evades treatment with antibiotics. And so it is really clever at hiding from treatment. Okay, and the more it can, we'll just use more, I want to use more lay terms, the more it can kind of bore into areas, it really is good at hiding. So it forms this like slime. I don't know if you guys are Ghostbusters fans or not, but I don't know if the opening scene, you should watch it, because then you'll know how Lyme disease works. But they're in the library in Columbia University, my alma mater in New York City, and they're all there, and Venkman and Egon, all those guys, they're there, and they see the big green blob. I don't know if you remember that ghost from Ghostbusters, and you guys that listen to the program, you know me with the movies. But anyway, the blob just comes, right, and it just goes through them, and they get slimed. And so he's like, I've been slimed. And this is exactly what this bug does. It creates this slime. It's called a biofilm. And this biofilm protects it, and then it can hide. So it's very difficult to treat at certain, times. And I'm going to do a lot of that. Those of you that follow me on social and other places, I'm going to do an entire series on Lyme, going through all the science and really breaking it down in a way that is easily digestible. But the name of the game here is, it is something that is so good at evading our treatment strategies. Now, on top of that, you get the gang comes in. So a lot of people get co-infections with it. So we just say, those of us that treat these conditions, that a tick is the nature's dirty needle. Right? You don't want to pick up, you don't go into some random porta potty and pick up a needle and inject yourself. I'm telling you, nothing good's going to happen from that. That's what happens when you get bitten, by one of these ticks, and then you get these bugs transferred. But guess what? Sometimes it's not just that bug. You get things like Babesia and Bartonella. I've had, I just had recently had a patient that had Rocky Mountain spotted fever, kind of all, on top of that. So anyway, you could get all these different co-infections. If you're not looking for them, then you're not treating them, because those are treated somewhat different than Lyme itself. So people have Lyme, they have these co-infections, they have all this stuff going on. I could tell you, it wreaks complete havoc on the immune system. Now, a lot of times, again, I'm talking not the acute phase, but people that become really just chronically ill with this stuff, we start looking for antibodies. But many times when the immune system has already crashed, guess what? You're so depleted that sometimes those tests can be negative. So there's a whole, special testing strategy that you can use to really try to figure out, does this person still have the bug in there? Do they have the co-infections? Do they have all these other things? Certainly, please come down to the clinic if you want to be tested or learn more or whatnot. But the name of the game is people that have Lyme are just dealing with all these different things. Now, on top of them being difficult to kind of pick up whether or not they still have an active infection, and you have to use things like PCR, looking for the DNA of the bug and not, again, outside the scope of this, it is we call Lyme the great mimicker. Now, what does that mean? People present with all kinds of stuff from Lyme disease, right? That's hard, right? So if you have a broken bone, if you fracture your wrist hurts and it's deformed, right? If you have other things, like if you have just a classic cold, right? Your nose is running, you have stuff, you kind of know the symptoms. You're saying, I have a cold, or I have coronavirus, or I have whatever. But something like Lyme's can present with joint pain, headache, psychiatric symptoms, all like rashes. There's all these crazy rashes that can develop after Lyme, severe fatigue, difficulty with eating foods. You get all these secondary syndromes, so it's very hard. So these people are stuck in this crazy loop. So, right, it's hard to diagnose. It's hard to figure out that we should even treat, we should even look for it, because the symptoms, it's all over the place, how people present. So there has to be very much an elevated, there has to be an elevated top of mind concern for people having Lyme when they come in for these really vague complaints. And so many people are not being tested for this because it's not on the radar. So it really needs to be on the radar. So if you're suffering from any kind of symptoms, you've been, out in the woods, or there's any way that you could have been exposed to a tick bite. And again, a lot of these are missed. Right? So you say, I don't remember. It doesn't matter. You could have been bitten by a tick. So ask your doctor or provider if you should be tested for Lyme. If they say that you shouldn't, you should, go a little bit deeper, ask the questions, find different providers. But there's no harm for being tested for something when then you can get put potentially on the road to much better treatments. So that is Lyme. We see a lot of it. People go from doctor to doctor. The average person, if you look at some of these things, have seen 5 to 7 doctors for their symptoms and their conditions. But yet here they are still rolling into our integrative health clinic, right? They're just circling and circling and circling, and it is everything for them. It's their entire life is dealing with their Lyme disease. Okay, period. So that's Lyme. So we'll put this on hold, because I'm gonna unify the two things and why I am so passionate about approaching these problems with a physics approach. I'll explain that in a little bit. Let's talk about mold toxin illness. Like I said before, a lot of you are exposed to higher levels of mold than you would ever want to be exposed to. Environmental Protection Agency, 50% of U.S. buildings have water damage. 50%. We are building very differently. We used to build, with stone, and now we build a lot with paper and plastic. You've got drywall, you've got different wraps where you seal the house like a Ziploc bag, and now you're trapping all this moisture in. And so these spores that are in there, even if you bleach it and you break it up into fragments, it breaks up into these billions of fragments of nanoparticles with toxins, and you're taking this stuff in, and then people become sick. And I will tell you that it is like the treatments are not even starting because it is being missed in the first place. So let's talk about, different toxins and kind of how they work. I mean, these toxins are literally biological weapons. Okay, these are weapons of mass destruction. They're weapon grade, poison. We call them mycotoxins, and you can get it from black mold. There's all kinds of different things. I don't want to go into the different types of exposures. I have a white paper out. You can read that about that goes in a lot more depth on all of this stuff. But the thing about the mycotoxins is there's something called they're lipophilic. I know you probably have no idea what that means. Lipophilic means that they like fat. They're fat loving, so they're very absorbable in these fat structures. So they can bypass the gut and they can go right into the brain across the blood-brain barrier. Now, there's other reasons why that blood-brain barrier can deteriorate based on very certain parts of the toxin that can affect the blood-brain barrier. But the take home is that these toxins get into the brain, which is why we see so much neuropsychiatric disease with this. And there's this misconception that if you have like mold toxin illness, you have to have all these respiratory symptoms. That's false. There are people that just present with these neuropsychiatric symptoms. They're very tired and they have stuff, and it's a very specific pattern of neuropsychiatric symptoms because it affects things like the basal ganglia and other areas of the brain in a specific way, and specific toxins affect specific parts of the brain. And so you get these interesting presentations, interesting for us as providers, not interesting, obviously, for the patient. I don't want you guys to take it that way. But I do want to go a little bit into this gene phenomenon. So again, you can be more prone to getting this kind of toxin illness where you're really sick. So you could be really sick, whereas your spouse or your kids can be fine. Why? Because you may have a specific gene for it. So there's something called an HLA-DR mutation. Okay, 24% of the population has it, not 2.4, 24% of the population. So again, we already laid out the foundation. 50% of structures may have some kind of water damage. Okay, this leads to mold. Then we insulate it all into these homes and these buildings. Now you're breathing it in. So think about it. If 25% of you are extremely susceptible to the downstream effects of it, that's a lot of people. Right? There's millions of people that are suffering from mold toxin illness, and most of them don't know it. And so this is something I really want to bring awareness to. Why are they more susceptible? Well, guess what? Their immune system, because you have this genetic mutation, is blind to the specific toxin. So it can't see it, right? So if you have the good genes for it, when you see the toxin, you start fighting it, your immune system can do its thing. That doesn't mean you're not going to have symptoms, but it's different. But if you're blind to it, the toxins just flood your body, okay? And they recirculate in your lymphatic system and all through your tissues, and then people get sicker and sicker and sicker. It's very similar to some of the autoimmune diseases where things are recognized different. Instead of recognizing foreign things as foreign, for example, in multiple sclerosis, you recognize your body as a problem. So you start attacking nerve cells. So similar in this mold toxin illness, right? You get your immune system starts doing weird stuff, and you start having all these different symptoms and inflammation and all kinds of things. So there's so much tie-in between Lyme, mold, and what other autoimmune diseases, look like. Even though these are not technically put under that basket, they present very similar because they are an immune problem, after all. So hopefully that gives you a general understanding of those two diseases and why they're so hard to deal with. Obviously, I go a lot more in depth. Please go to the blog on hyperchargehealth.com. I have all kinds of things on Lyme disease and on mold toxin illness if you really want to get in depth here. All right. Medicine. I've talked about this a long time. I mean, it moves like a snail with some of these things. Generally, medicine has been really good at defying illnesses, right? For example, like things where it's a genetic illness or it's very specific, okay? Like if you have sickle cell or you have other stuff, we can talk about it. It's one specific mutation. You get a certain thing, and then people can really put all their efforts, because if you have one variable, it's a lot easier to attack it. It's a lot easier in the lab to do it. But again, these two illnesses, along with a lot of autoimmune conditions, they fall under this bucket. I really don't feel well. I have brain fog. I have this and that. They present with a myriad of symptoms. It's multifactorial, meaning there's so many different parts of what's going on that eventually causes people to be so sick. These are a lot harder to get around. Then there's this misperception, and I will tell you, and those of you that are suffering from this, you know this, right? I told you about it's all in your head. People, again, I don't want to be derogatory. I don't even know how to say this, but I hear people talking about, and I say people, when I say people, I mean providers. I hear them talking about these patients. They don't want to see them as a general rule, right? Because they consider them, kooky or wild, or sometimes they get labeled as they're nuts and all these other things. You know what? If I had the symptoms, I would also probably be labeled as nuts too, because I don't want to deal with what they're dealing with. It's devastating. So we need to really think about how we talk to these patients, how we evaluate them, and then ultimately how, we treat them. So it's just a very difficult thing. Now, there is this recognition gap. I'm actually going to write an entire white paper on how some of these diseases take so long to be recognized. You guys have heard recently about the whole mislabeling of basically hormonal replacement in women. It's all over the place on 2020 and whatever, based on old data, old terminology. It's taken us 20 years to say, oh, we should remove the black box warning on like estrogen replacement, right? That's how long, that's how slow medicine takes. Very frustrating. The same thing happens with diseases like Lyme because of the crazy different presentations and mold toxin illness. Okay, if you look at independent bodies like the World Health Organization, the International Society for Environmentally Acquired Illnesses, they're finally really acknowledging the extent of these crises. And kudos to them. I'm very happy because when the big boys speak, people start to listen, but it is so obvious that it's a crisis. All you need to do is look. It's just like all these other things. Look, it's concussion. Talk to people. Look. If you don't look for it, you're going to miss a lot of it. So we really have to look. Insurance. We've talked about this ad nauseum. This is my stance. A lot of these treatments that are being done for these people that have devastating illness, yeah, insurance covers traditional standard medical treatments. Some treatments are okay. A lot of them are completely irrelevant. You need to go way beyond that, whether it's functional medicine, the biohacking strategies that I'm going to talk about in a minute, or other things. Most of these things are not covered. It's ridiculous. It's absolutely ridiculous because people need help. We've got to recognize these syndromes and not just recognize them, then be able to launch strategies and plans to actually help, these people. So here's my stance. You guys know this. I'll be very quite honest. I hear the patient. I treat the patient. I don't treat an insurance manual. We've got all kinds of options. If the biomarkers match the symptoms, we get them, we treat the toxicity, we do all these other things. And a lot of times people have to make the decision to invest in their own health care. They have to make the decision to be the CEOs of their health because the other strategies just don't work. They just do not work. Yes, do some people clear on their own? Yeah, but millions of people are just struggling with these symptoms, and a lot of them, they don't even know what they have because no one's gone down that path to really diagnose them. So I want to just talk, as we, kind of get to the end of this segment in the philosophy that we have, created in our integrative health clinics. And a lot of it's not like we are... Right? I was trained in other things. I'm taking my knowledge from other things. Other providers I'm working with are taking their knowledge from potentially they've been in other areas, okay? But, formulating these think tanks, you start saying, how does this translate over, to this thing? So here's our take generally on this. Traditional medicine, when it comes to acute Lyme disease, fantastic. Treatments are fantastic. I encourage everyone, you get a tick bite, you have symptoms, please get treated. Fantastic, okay? When it comes to chronic Lyme or chronic mold toxicity exposure, these kinds of things, it's really bad. We're not good at that. And so we have to go a lot deeper. And so I want to give a lot of credit to these functional medicine, gurus that have really come up with great treatment strategies that go way above and beyond, both as far as diagnosing patients and as far as treating them. And they've made a significant impact in people's lives. Like I said before, although I think that those strategies are great, and we have a lot of patients that continue those strategies, or we use parts of those strategies, et cetera, their batteries are on empty. And I have an entire paper on this when it comes to, specifically, I did one just specifically on mold toxin illness, when it comes to the fact that we're trying to, like detox these patients, or, bind their toxins and do all these other things. And they struggle because they have no energy in their cells. Okay, they have no energy in overall. They feel not energetic, but I mean at the cellular level, their cells are working terribly. And so then you just start doing all these interventions to them, and again, they can get worse. You can't detox a dead battery. It's dead. Like if you go to your car and your car's dead, say, hey, let's drain this more. Like, it's dead. So this is what we're trying to do. So I think that when these people take these binders and other things, if you do them in isolation, they can crash, right? So detox is energy expensive. Okay, when people say we're going to detox you, that takes a lot of energy. That takes a lot of things going on in your system, which have to work really hard to do it. But if you're in, we'll call it a mitochondrial winter, mitochondria, the powerhouse of the cell. If your mitochondria are not fine, you don't have any energy to take out the trash, so it's just going to make you more tired. And so what we really focus on is using physics and something we call the hypercharged full stack approach. Okay, again, it's not that we're not believers in the chemical approach that functional medicine espouses. It's that you have to charge the battery. So how do we do that? Remember, biohacking is hacking biology by using different things. And so we charge the battery utilizing light therapies. I've talked about ad nauseum how mitochondria have specific receptors that can absorb the light, and it can really supercharge them. This isn't because I want this to be like, it's not, oh, I'm wishing Sinicropi, he wishes this was this. This is hardcore science. I can give you hundreds and hundreds of references showing how these things work. The next thing is something called pulsed electromagnetic frequency. You can restore cellular voltage, right, so that the toxin can actually leave the cell. This is like these are first principles, and people are not doing it this way. It's very interesting. We use other therapies like oxygen through exercise while under oxygen therapy. Mold and Lyme, they want to be in these anaerobic conditions. In other words, they like it when there's no oxygen around, right? Where they're dead zones. So if you flood the plasma with oxygen, it makes the body more hostile to these things, and it lets things heal better, and those other interventions work. There's something that is, I'm telling you, this part is being so missed by so many in the medical community, including people, that is flushing the lymphatic system. You can detox people all you want. If their lymph is filled with the detox substances and you don't flush the lymphatic system, guess what? They're going to still be stuck in these loops. They're not going to be well. So that's another huge part of this kind of full stack strategy that we have for these two particular conditions. Now, they're a little bit different. There's nuances to them. Again, this isn't medical advice. If you want to come in, we've got so much for these conditions. But there's something called the Neuro 20 suit. And it is something that it looks like a wetsuit. You put it on, it stimulates 42 different muscles in your body. And that actually has clearly been shown to increase lymphatic drainage, pump out the lymph, and then that trash can be taken out, recirculated, and that's going to help you with all the other treatments that we are doing. So, in essence, and we'll pick this up on the other side of the break, as I'm just going to talk about kind of general, medicine in these conditions and why we are like in these spirals, which we shouldn't be in. So you're not crazy, okay? You're not kooky. There's nothing, there is something wrong with you, but there's nothing wrong with you in the way that people might be accusing you, but you're poisoned. Your brain is poisoned. Your body is poisoned. But the biology is resilient. And so if we can hypercharge your cells, if we can recharge your human battery, we can get much better outcomes in conjunction with other things that have already been discovered and are out there. So we'll talk about this more on the other side of the break. We're on Recharging the Human Battery Radio. I'm your host, Dr. Sinicropi, and we are on AM 950. See you in a minute. And welcome back as we wrap up another fun session of Recharging the Human Battery. Like I said, I hope that you guys have been able to stay on here on AM 950 radio and really listen to this whole thing, because people, are struggling. I wanted to talk a little bit about my own personal philosophy, because I want you to understand how my mentality has transitioned from treating one type of chronic patient to treating another type of chronic patient. But again, the similarities are there. And this is something that we really have to think about when we're treating, these conditions. I'll tell you, AI, the way that inference works is the same way kind of the human brain works. And that's, we take principles and strategies from one thing and apply it to another thing. And sometimes, eureka, that's how we should be looking at things. I talked about my frustration about how medicine is so slow to work. It took 50 years before people started talking about it for everyone to agree that we should wash our hands to prevent infection. 50 years, okay? Give or take a couple years. We have these lag phase. When it comes to these environmental exposures, I've interviewed people talking about like toxin exposures in the military. Do you know how long it took before there was an admission that a lot of these toxins were creating horrendous illnesses in our veterans and our active duty soldiers? Right now, it's on the radar. The VA, recognizes these things. People are getting their disability claims fulfilled, and rightfully so. They're serving our country. They've been basically poisoned, in duty, and it's out there. And these things are happening on a much, much larger scale when it comes to Lyme disease and mold toxin illness, because they get different labels. It's very complicated. And so when people come up with different plans and strategies, the traditional medical system, right away, what do? It doesn't work. That does nothing. I can't even tell you how many of my patients, the ones that are actually already doing well with all kinds of different, conditions, have mentioned this to their own doctors and say, hey, either they say, hey, should I keep doing this? Or, hey, what do you think? I did really well. The level of disbelief in some of these things, it's insane. And not only sometimes do they tell them that they don't know anything about it, they just say, well, you shouldn't do that because they don't know anything about it. Well, that just makes zero sense. We could do a whole show about that. I think, we've talked about that, before. So how I want to really wrap this up is, from a science standpoint, approaching the biophysical, physics, right? We're giving your body energy. We're giving your body electrons, to get a little bit more in depth, and energizing the body. We're clearing out your lymphatic system. And that is allowing you from recovering from some of these illnesses, along with other things that you may be utilizing from other providers and such. Obviously, we put together a overall comprehensive protocol so that it's not overdone or underdone, et cetera. So that's one thing. The other big takeaway is, for all of you guys that are listening out there, one, if you have a family member, if you yourself are struggling or whatnot, seek care. There are options out there that you have never heard of that have tremendous scientific rationale behind them. I want you to learn about them. Please go to the blog. Please read on your own. There's so many resources, even in the blogs. I list the entire bibliography. You could read ad nauseum if you really want to get down there. The other thing is, if you're suffering from these symptoms, if you have brain fog all the time, you don't feel well, your energy levels, and I mean like you're just like, man, something is really, really wrong. Okay, now it could be something like seasonal affective disorder, which is something that we treat all the time here in Minnesota. It's dark, but it can be one of these more serious illnesses, and we need to get to the bottom of it. So if you have these symptoms, go in, get treatment, get tested. See what happens. Okay? Don't let people, oh, it's controversial. We shouldn't test you for this. We shouldn't do that. Well, why don't we find out first what you have, and then we can come up with a plan and strategy. So hopefully this helps you and your family members become the true CEOs of your health. It's been a pleasure. We'll see you next week on Recharging the Human Battery radio show. We're on AM 950 radio. I'm Dr. Stefano Sinicropi, and as always, I'm fired up about this stuff because we just need to change how we do things. See you next time.